Thank you. Well, that was provocative, what we were just listening to, and this is a chance now to hear about, I think, a part of public health that we simply don't hear enough about. So I am really excited to have this conversation with each one of you. I'm going to get each one of you to talk about what you do and why it matters and what the connection is to public health. So Jennifer Gould, I'm going to start with you. You are the CEO, as we just heard, of Neighborhood Design Center. So tell us what that is and what you work on.
Great. Thank you so much. The Neighborhood Design Center is a nonprofit organization. We're based in Maryland, in Baltimore City and Prince George's County. And what we do is we provide community-engaged community design services to neighborhoods who ask for them. We were founded in 1968, and over our 50-year history, we've worked on almost 3,500 projects. Those can be everything from a vacant lot up to a community master plan, tackling the challenging issues that low and moderate income communities in those places face.
And how do you do that?
We do it in a huge variety of ways. So the communities come to us and they say, we're trying to tackle an issue. It could be drug dealing in front of a vacant lot. It could be seeking support from the city agency to have more active transportation in their neighborhood. They know what they need, and we trust that they know what they need. And so we put together a design team to work with them directly and come up with those solutions that they can either self-implement, advocate from the city, go for funding from the state. There's a number of ways that the people in the neighborhoods are working to address their serious challenges.
And just quickly, one other thing, how do they know about you? How do they know to reach out?
Yes, it's primarily our long history of working in these neighborhoods, so that we're an integral part of the fabric in the places where we work. We're a very highly trusted entity, so they hear word of mouth primarily, that you can work with NDC. The agencies recommend them to us. The funding partners recommend us to them as a way to organize, understand the way that their issues intersect with space and their places, and to think about ways to tackle those from a greening or a built environment kind of perspective.
All right, I want to turn to you, Michelle Kondo, next. As we heard, a scientist, U.S. Forest Service, Philadelphia Field Station. The U.S. Forest Service, yes, it does operate in American cities and heavily urbanized areas. So tell us what your focus is, what work do you do?
Right, so I'm a scientist stationed in Philadelphia, and you probably don't think of the U.S. Forest Service as having playing a role in urban areas, but there are nearly 170 million acres of urban forests, and the mission of the Forest Service is to care for the land and serve the people. My research, I look at nature-based or place-based interventions and their effects on violence, on crime, as well as on human health. And a lot of my work has to do with these vacant spaces that plague not just Baltimore, but cities like Detroit, Flint, and my city, Philadelphia. They have a negative impact on residents' health. So living near these spaces, and Philadelphia has, by some counts, 40,000 vacant lots that they cause a lot of stress and anxiety for people that live near these lots, and that these spaces sometimes play a role in illegal or illicit activity. So the drug trade, as we've seen in our city, as well as other types of crime and violence. But there are many community organizations and municipal agencies that are trying to reuse and adaptive reuse and mitigate these issues, sometimes through intentional design, but also sometimes through these large-scale interventions that you might see here. So I've brought some photos or images along that you can see.
That's the same place, right?
Yes. Yeah. And so this is an intervention done by the Pennsylvania Horticultural Society in Philadelphia. And they have done this type of remediation to over 10,000 vacant parcels across the city.
Wow.
Yes, with largely with support from the city of Philadelphia. But recently, my colleagues and I at University of Pennsylvania, Columbia University, and Rutgers, we conducted and just published results from a randomized controlled trial that we conducted of this type of greening intervention. And we were interested in its impacts on violence and on perceptions of safety, and as well as on mental health. And we found, so we took 600 vacant lots and we randomly assigned them. Some of them as controls, so nothing happened, right? And then also as intervention lots where we did this cleaning and greening treatment. And we compared before and after what types of changes in these outcomes did we see. We found statistically significant reductions in all crimes, but specifically in gun assault, so violent crimes, and burglaries, nuisance crimes, especially in high poverty neighborhoods. We also conducted 500 surveys of residents nearby and found that people reported going outside more often. They also reported feeling less depressed and less worthlessness, right? So we're seeing a high impact there.
I was trying to listening to you, trying to understand what is it that makes the difference? Is it the fact that they can simply walk out and look at this, which is more pleasing to the eye? Is it that, what is it about these spaces, cleaning up these spaces, making them more appealing,
right,
that can change behavior?
Well, I think that some of what we'll hear from Rodette will be able to explain some of those mechanisms. But people reported that they spent more time outdoors.
Right.
So, right, and we also think about this broken windows theory, right?
And I want to come back to you in a minute and talk to you about the community, what it takes to get this done, because that's another question altogether. But Rodette, this is a perfect segue to you. Rodette Jones is the Community Garden Director for the Filbert Street Garden in Baltimore. So Rodette, tell us a little bit about the neighborhood and what your job is and what you do.
So I am the Director of the Community Garden in Curtis Bay, which is located in South Baltimore. And actually, I try to connect the residents, which is the students of the Curtis Bay Elementary School, the Ben Franklin High School, and also the Curtis Bay Rec Center with green spaces that is located in our community, which is our community garden. Our community garden is adopted lot through the city of Baltimore. And what I do is let the students come to my garden and use educational resources, which we have ducks, chickens, we have bees, we have geese, and we have billy goats. So the kids come over and actually they do connect with the animals, because a lot of times the underprivileged kids don't have the resources to go outside the community to experience going to the zoo, as simple as going to the zoo or going outside of that space to utilize other resources. Also, the kids also come up for gardening activities. They connect with green space through that. They do gardening. It gives my heart warmth to see the kids come up and plant a seed, and the seed grows into a flower, and see them nurtured and watered and put their hands in the soil. And the little girl once told me, she said, whatever day, don't miss Mondays, because Miss Rodette comes on Mondays, and we go to the garden on Mondays, so we have to be there. Don't miss any other day, don't miss Monday. If you miss any other day, don't miss Monday. So it was like with that, we see the kids connecting to the green space. And we also see them connecting to the green space because we have what we call a Baltimore Compost Collective in our garden, that we repurpose food scraps from the community and have the high school kids come over and chop up the food scraps and making them compost and putting their hands in it and seeing what it recycles and repurposes food scraps. So that's what I do, and what I also happen to, like, is going to workshops. And what I do, go to workshops outside of the community, gardening workshops, food compost workshops outside of the community, and taking all this knowledge from those workshops and bringing it back to the community and giving it to the community so they can be sustainable. So that's what I do.
It's fascinating. What do you think changes when whether it's kids or adults, when they get their hands in the dirt, and whether it's a garden or with an animal, what changes? What do you see?
So a lot of times we live in a poverty-stricken community, which is a food desert. So what I see change is that the people are getting the resources and the knowledge and the education that they wouldn't get anywhere else, that I'm teaching them, and it warms my soul to see that they are learning something and knowing how to sustain their own resources. They don't have to depend on a grocery store to get fresh fruits and vegetables. They can actually grow it themselves in the garden or in their own backyard.
Jennifer, how difficult is it to get this kind of work done? I mean, to change a quarter of a block, to change these spaces that just get grown up with weeds and become unsightly, to change those places, because you've got to have the cooperation of the city or the county, depending on what part of the country you're talking about.
It's very difficult.
Local merchants. I mean, how do you get it done?
Yeah, and it really has to start from the people of the place itself, because they're the ones that are there every day being impacted by whatever's happening in that land. So the work of NDC really starts from there, that the community comes to us with a vision, and we learn how to translate that vision into a design that can attract the support of the city, so that they have tools that will bring that yes from the city agency that's going to have to take the work to identify 17 separate property owners and get them to either take the property from them or get the sign off that they can use that space. They're the ones that are going to have to go out there every single day and pick up the trash. Often these lots are places where row houses have been demolished and it's just a rubble pile. You have to haul all of that away and replace it with healthy soil and water it on the dry days and show up and throw your birthday party there so that people view it as a healthy, safe place.
Throw your birthday party there.
Yes, I mean, those are the kinds of things, you know, have the birthday parties, have the horseshoes, have the weekend dance competition, have a ball and a shed so that kids can actually play there, set up the dumped tires and plant them with flowers, and just show that there's agency in the space and show the city that it's a place that's worthy of investment. And so there's often years of that just basic level participation from the community before the point of view of the city changes on these spaces. It's a very resource poor scenario, and so you have to demonstrate to the city and to the agencies and to the funders that this is a place that has community passion behind it and is worthy of that care.
And Michelle, how does your research inform that? How do you bolster the case that the residents, the city, whoever's behind this needs in order to make the case to get it done, whether it's property owners or others?
Oh, yes. Well, you know, we have calculated return on investment for this very simple type of treatment, which I think probably has maybe more limited impact, maybe even than the types
it has scale, though, which I think makes a big difference.
Yes, yes. But we found, based on costs saved from violence and crime, and all the hospital bills and all the costs to society at large, criminal justice, $26 in net benefits to taxpayers, and over $300 in savings to society at large per dollar spent on the program. And each vacant lot in the photos that you saw costs about $1,500 up front, and then $200 in maintenance per year.
So tangibly, in dollars and cents, you can show that it makes a difference.
Yes.
That there's a return for whatever the investment is.
And so that's that research is so important to groups like the neighborhoods that are trying to get their spaces saved, is you can show that if you make this minimal investment in their communities, it has a huge return, not only in cost savings, but in reduction of violence and improved mental health, which are the main things that communities are trying to address.
Rodette, give us a sense of a personal example of either a family or an individual who you've seen the course of their life change for the better because of this kind of work that you're doing.
So I've seen that the students at Ben Franklin that had participated in the food compost collected project, I've seen their life had changed. For example, Roman is one of our former students, workers that was working with the compost collected. He attained the skill doing compost and being responsible, showing up on the job on time, knowing that he was making a difference in the community, and working there for maybe 6 months to a year. He showed leadership skills, and that in turn transferred into a work empowerment program that he went on and became manager of a Subway. So that's my personal experience.
And is this the kind of thing that you think could be repeated in other parts of Baltimore and other parts of the country? I mean,
Oh, definitely.
Is this something this can work in any urban environment?
Urban environment, yes, definitely. You know, if the youth are given the opportunity to learn skills, gardening skills in my case, that these gardening skills can turn into landscaping skills, you know. So definitely I can see that somebody can go far with this type of career.
All right, we've got about 2 minutes left. Is there anybody with a really terrific, urgent question you want to ask? I have a hard time seeing with the light, so if there's not, I want to come back because to me this is fast. I would just want to come back quickly to you, Jennifer, to remind us, you know, how it's counterintuitive in a way. You think of public health, you think of doctors and hospitals, and maybe you think, you know, increasingly of adolescent health, obesity, and the rest of it. But this is changing where people are and what they see when they walk out the door.
And it's coming from themselves.
Right.
This is not an external, I mean, obviously the world we live in is external, and there are forces that are affecting our health, but it's also that inspiration and showing of agency in your own world that I think environmental change, that it's led from a community, changes, it really builds social network, it builds individual power, it's transformative in its action-based way of addressing health, but also showing just that the environment itself, you know, so it's a multiplier, showing that the environment itself is having a negative effect on the community at large, that you can be doing something that is individually making yourself healthy, that also at net makes the entire place more healthy.
Well, it's exciting to see the passion of each one of you. Rodette, Michelle, Jennifer, thank you so much for telling us your story. And to the audience, I just want to let you know we're going to take a 20-minute break. You're going to have a chance to talk to each other, get another cup of coffee. When you come back, a very special surprise.